Hi, everyone. Thanks for stopping in to listen to my presentation. My name is Youngdeer. I'm the Public Health Program Coordinator with the California Consortium for Urban Indian Health. Today, I'm going to talk to you about our collaborative approach to addressing substance use disorder and opioid use disorder, not just in California, but specifically in Indian country in California. Go to the next slide. So a little bit about the organization that I work for. We're a consortia of the 10 urban Indian health programs throughout the state of California. Our mission as an organization is to facilitate shared development resources for our members and to raise public awareness in order to support a health and wellness network that meets the needs of American Indians living in urban communities throughout the state. So this is our core programming that we do in our organization, community health organizing. So we leverage our urban Indian health program clinical leadership and our grassroots community guided efforts to address policy needs and healthcare inequities for American Indians in California. A lot of our work is community health, is community education, material development, for a lot of different topics. We have programs around Hep C, substance use, the missing and murdered Indigenous women's movement, the domestic violence. We also provide a lot of technical assistance to our programs. All of the technical assistance, all the work that we do is culturally and traditional based. We host seminars for our members. We host a conference for our member organizations. We also, like I said earlier, do a lot of public education and civic engagement. One of the things that our organization also does is policy advocacy. So we work with state legislation and the government to help pass and guide bills through legislation that will ensure that the urban Indians are included because we're often a community that's not involved. And so that's just one of our roles. Okay, go to the next. So these are our members, and you'll hear me talk a lot about our members today. So just remember this slide. We have organizations spanning all the way from Southern California all the way to Northern California. And our programs vary on their service provision, depending on the organization. So you can see on here, Friendship House and Native Directions, Inc. Those are both residential treatment facilities. Most of our facilities are full-fledged clinics, and we do have a couple of access and referral clinics. You can go to the next slide. So what I'm specifically going to be talking about today is our tribal map project. So this project is funded through the Department of Healthcare Services in California. And so this is a partnership between SACUI, which is my organization, the California Rural Indian Health Board, or CRIB, UCLA, the University of Southern California, and Kaufman and Associates Incorporated. And this whole presentation is really about collaborative work and how all of our organizations are working together to address opioid use and substance use in Indian country in California. So throughout this presentation, I'll show and talk about how we're all working together in different but similar ways. So our approach in this whole project is to reduce the prevalence of OUD and opioid overdose deaths. We do a lot of opioid use prevention through community education. And I'll give some examples of the community education materials that we use. We work on OUD treatment and medication-assisted treatment expansion and access expansion throughout the state in both the tribal and the urban Indian communities. We work on naloxone access expansion, so making naloxone and opioid overdose prevention a lot more accessible. And we do support system development and involvement, which means that we're trying to help our organizations create sustainability within their programs so that when this funding leaves, they will still have a pretty sustainable program in place. You can go to the next slide. So one of the partners that I wanted to talk about, and you may have heard of them before, the California Rural Indian Health Board. So this health board is a network of tribal health programs controlled and sanctioned by Indian people and their tribal governments all throughout California. So CRIB is committed to the needs and interests that elevate and promote the health status and social conditions of Indian people living in California. CRIB services by providing advocacy, shared resources, training, and technical assistance that enhances the delivery of quality, comprehensive health-related services. So I really wanted to focus in on our partnership with CRIB because it's through this partnership that we're able to reach all of Indian country in California. So as you can see here, these are the CRIB members. They have 18 tribal health programs and 58 federally recognized tribes that they serve. So these are their full members you can see here, and then their associate members. You can go to the next slide. So I like these two maps because it illustrates the coverage that through the collaboration of our two organizations, we're able to reach literally all of Indian country in California. And if you don't know anything about the spread of California and what it looks like, California has a densely populated American Indian Alaska Native population all throughout the state, all in different areas. 90% of the American Indian Alaska Native population does live in cities. So as you can see on the map on the right, those are the areas that our organization covers through this tribal mat expansion project. And on the left, that is the members of CRIB and the areas that they cover. So as you can see, I really like to talk about this collaboration because it's just so widespread. Okay, you can go to the next slide. So all of the things that I'm getting ready to talk about is a part of our mat expansion project. And these are things that both CRIB and my organization work on separately and sometimes together. So our organizations have things called MAT champions. And basically our roles are to connect, communicate, and coordinate activities between our project collaborators, other Indian programs, non-Indian MAT providers, and the California hub and spoke entities. We host meetings and trainings around expanding opioid use disorder prevention and MAT services, and also provide naloxone trainings and naloxone training materials to each of our organizations. So our role, you can go back to the last slide real quick, sorry. So our role really in this, our MAT champions role, is to make sure that our project collaborators, that is the ones you saw earlier, CRIB, Kaufman, USC, and UCLA, and the state are all connected and are aware of what's going on in each other's projects. We also have the role of making sure that our American Indian Alaska Native programs are aware of each other and know what's going on so that they can learn from each other. And then making sure that they have access to non-Indian medication-assisted treatment providers in the area. So if they need to send referrals out or collaborate with those providers. They know how to create the relationship. The California Hub and Spoke project is basically an access and referral system. And California hubs and spokes are the main areas for treatment referrals. And so we make sure that our programs are integrated into this hub and spoke system. Okay, you can go to the next slide. So one of the things that we really like to work on, because there's not any resources like this out there for our programs, is a culturally adapted opioid campaign. So through this part of our project, we develop, collect, and disseminate culturally tailored materials to address opioid overdose prevention and reversal trainings, OUD prevention, treatment, and recovery, medication-assisted treatment and access, safe opioid prescribing and disposal, opioid education. And all of our materials are created in a way to reduce stigma around opioid use disorder and medication-assisted recovery. So we do have materials that are very specific to addressing stigma, addressing myths around substance use disorder and medication-assisted treatment. But in the next few slides, I'll give you some examples of what those are. So you can go to the next slide. So this is one of our materials. Our artist is local and she is Native. Her name's Jackie Fawn, and we're very lucky to have her. So this is just one example of one of the posters that we give out to our organizations. As you can see, we try to keep it lighthearted and really try to offer strengths-based materials and positive messages. So this is just one example. You can go to the next slide. So this is another one of our materials. At the end, I'll give you the website, and you can see all of the materials there. So this is our Hope Without Stigma booklet, recognizing and responding to an opioid overdose. So this is the booklet that we give out when we do naloxone trainings. And it gives an overview of what opioids are, what naloxone will work on, and how to administer naloxone, and how to save someone's life if they're in an overdose. Okay, go to the next slide. So within the last year or so, and I'm sure you all are all aware and have heard of fentanyl, we've really seen an increase of fentanyl overdoses in California, and we've really seen a lot in the San Diego region, but also in northern rural California in some of our tribal communities. So one of the things that our organization does really well is to make sure that we're getting information out in a timely manner, and making sure that people are getting what they need as soon as they can. So we started working on this fentanyl fact sheet because people kept asking questions. What's fentanyl? What does it look like? And it's really stigmatized, and people can be very scared of it. And we kind of wanted to combat a little bit of that. So we created these fentanyl fact sheets to provide community education on fentanyl, but to also dispel myths surrounding fentanyl, and making sure that people knew that naloxone will work on fentanyl, and that naloxone can help them save somebody's life if they're using fentanyl. We're also working on getting fentanyl test strips distributed throughout our communities, with the granting and be able to use fentanyl test strips and purchase fentanyl test strips through our SAMHSA funding. This is something that we're really taking on. So we're working on educational materials about that. We have really good relationships with the harm reduction programs in the state of California, with the Harm Reduction Coalition, which is located in Oakland. So we're working with them, with our partners, to try and get the fentanyl test strips out and make sure we're making educational materials that are simple and understandable by the community, because people are really looking for materials and for fentanyl test strips. Okay, go to the next slide. It's anyone, if you have any questions, feel free to put them in the chat. Happy to answer anything while I'm talking. So one of the biggest parts that I've already talked about a little bit is naloxone purchase, training, and distribution. So through our two organizations, CRIB and SECUI, we distribute naloxone throughout the state. We purchase our naloxone through Adapt Pharma, and we distribute the Narcan to our urban Indian stakeholders, but also anyone who is looking for it and they don't have any other way to access it. And if we don't have any in stock, we send them in the right direction to purchase some. We provide educational materials and trainings on opioid overdose prevention, recognition, and response, the Narcan administration and the aftercare, and also on harm reduction. So when we do our trainings, we try to integrate the principles of harm reduction and talking about destigmatizing this use and indigenizing harm reduction in a way that we're taking care of our community and caring for our community members. So we really focus in a lot on that. And we also focus not just on reversing opioid overdoses, but teaching people how to prevent them in the first place. So for example, teaching people that if you're not getting enough to eat, if you're not getting enough to drink, if you're using drugs by yourself, that puts you at a higher risk for overdose. So we train people how to teach people how they can use safer, so they're not overdosing in the first place. And we really like to focus in on that piece. And I see this question in chat to Haley. Yes, those materials are available to other organizations. They're downloadable on our website, and I can put that in the chat at some point for you. Okay, next slide. So the booklet cover that I showed you earlier, this is the inside. So we go through and we tell people what an opioid overdose is. We also show them what it looks like so that they know, and we make sure to use inclusive language because a lot of the language that can be used is often for people who have a lighter complexion. So we make sure that people know what to look for and signs of overdose in someone who's darker complected. We go through the steps. If they're not awake, to use noise or pain, then they're an overdose. So that's just a sample of some of the things that are in that booklet. Go to the next slide. So this is the other part of it. So we talk about what causes an overdose, how does it happen? And then here, on the right is the rescue breathing page. So we try to give as many visuals as we can to show people what these steps should look like. Okay, go to the next slide. So the next thing I wanted to talk about is our collaborative work that we do as a whole. So the naloxone distribution and the MAT champion work is something that CRIB and SECUI do separately. But we also collaborate if there is somebody that needs something. But we typically, CRIB will provide naloxone and education to the tribal communities, and we would provide that to the urban Indian communities. So these are three things that we work on together. So Tribal MAT really is a unified response to the opioid crisis in California Indian country. And so three other things that we work on is the Tribal and Urban Indian Culturally Defined Best Practices Grant. I'll talk about that in a little bit. And the California Indian Opioid Safety Coalition, I'll talk about that too. And lastly, the California Indian Harm Reduction Work Group. You can go to the next slide. So our California Indian Opioid Safety Coalition, otherwise known as Kiosk, is a gathering of all the tribal and urban entities coming together to share information regarding their local opioid coalition work, which I'll talk about in a minute. Share community best practices, collaborate, learn from one another. We also host training sessions during this coalition meeting and build strategic partnerships and relationships. And this meeting is quarterly. So we have 4 every year. Before COVID, we offered 2 in person. And after COVID, we've only been able to hold things virtually. But before COVID, as you can see this picture here, this was one of our kiosk meetings in Temecula, down near San Diego. So this was a gathering. We came together. And one of the things that our kiosk serves to do is also to create change in our communities as a whole, and as a coalition. So in this, I like to highlight this coalition meeting because it was a meeting where our organizations were able to come together as a whole and create action items that they wanted to work on in the state. And so some of the ideas that came out of that, one was for a very large powwow to be hosted to provide community education, naloxone and naloxone education. And so that's just one of the ideas that they came up with. Unfortunately, we haven't been able to have another gathering like this since COVID hit. But now our portions are really virtual, and the format has changed a little bit. So you can go to the next slide. So this is kind of what our kiosk evaluation looks like. Our past number of attendees was approximately 426. But since we switched to virtual, I found that it has made it a little bit more accessible for people who want to attend. So for the past year or so, we've averaged around 100, 120 participants, and more registrants as they come in and out of the meeting. And our meetings usually last about 4 hours with a lunch break in between, and cover a wide variety of different topics. So we're getting ready to host our next one in October. But a lot of our topics flow around harm reduction. And one of the things that we really like to do is highlight what our programs are doing, because they like to learn from each other. And a lot of them do network during these meetings and learn what other people are doing and gain ideas for their own programs. So, which is one of the reasons why we started this this coalition. And this coalition has been going on for about 3 years now. So it's really built. One of the things that we're really honed in on this year is on youth. So we're bringing in youth from around the state to come in and be on panels and to talk about what they're doing. This upcoming kiosk, we're bringing in youth to come in and talk about being community champions. So really finding youth who are making movement in their communities in a positive way, and bringing them in to talk about those things. And we're trying to, bridge that gap between our youth and our providers and our adults that attend these meetings. And so that our youth can really have a voice and say in what substance use and opioid use is looking like in the state. So with our evaluation, this is what our participants have let us know. So most of our participants have agreed that this coalition is an effective tool for addressing the opioid crisis in Indian country and California. This coalition makes a sincere efforts to consider cultural approaches in its work. So before our meetings, we typically have someone who will open the meeting in prayer. and someone who will close the meeting in prayer. And sometimes this looks different. Sometimes it's a song, sometimes it's a prayer, sometimes it's a drumming. It really just depends on who we have in that day, and we make sure that we include that in every single one of our meetings so that we can open and close in a good way. Members feel free to share their thoughts and ideas, and members feel they derive value through participation in our coalition. So one of the things that this coalition does is it brings together people from various different backgrounds, various different portions of their work, and exposes them to different ideas. And so most of our members feel comfortable that they can share their thoughts and ideas. Even if, they don't agree with someone, it's always a good place for people to learn about new things and new ways of doing things. You can go to the next slide. The other thing that we're working on collaboratively, and this is a collaborative venture between Kaufman and Associates, Sakui, and Crib. We're also working with the California Department of Healthcare Services on this grant in the Center at Sierra Health, which is an equality and equity organization located in Sacramento. So we created this funding opportunity for our tribal organizations, not just the clinics, but any organization that was interested in this and serves American Indian, Alaska Native people in California. And also the urban Indian health organizations, urban Indian health programs were eligible for this opportunity. So this funding opportunity gives organizations the opportunity to develop, operationalize, enhance, and sustain substance use disorder treatments with an emphasis on the importance of culture and patient engagement, treatment, and recovery. And so this grant, I feel, is a very huge deal for our communities because it is using state dollars, and the state has really supported integrating cultural and tribal best practices and healing modalities into our substance use disorder treatment services. And so that's what this grant is really about. And so as you can see in the little image here, we took up to 25 grantees for this grant. Grantees could either take a planning track or the implementation track. The planning track is for grantees who are really just starting in this work, and they have seen a need for traditional and tribal best practices to be integrated into MAT, or substance use disorder treatment services, in their area. And so this is allowing organizations to plan that, to work on policies, to work on relationships with those organizations, and to really see what it's going to look like, do community scans, find traditional tribal best practice that they want to integrate into the program. And the implementation is just the other side of it. It is starting where they're implementing this tribal best practice into substance use treatment services or recovery services. So some of the examples that we have for this, just so you can get a better understanding of what this this grant is. One of our grantees is working on the Kumi bird songs. And so that the Kumi bird songs are really a healing modality within their tribe. And so they're working on integrating those as a healing modality into their substance use disorder treatment service, and seeing how it works for a healing modality. So that's just one example. There are several other examples I could list, but that one is very unique and special. So I wanted to highlight that one. Okay, go to the next. So the last thing that we're working on together is the California Indian Harm Reduction Work Group. So the purpose of this work group is to establish evidence-based and Native best practices regarding harm reduction strategies, including but not limited to community outreach, coalition building, health education, policy advocacy, and others. This group was created by our organizations and supported by the state. And this group is community-led and driven. So this group is working to see what harm reduction is looking like in Indian country in California, to come together and see what their communities need, really. And so the members of this group are leading what they want to do in this group, what kind of action items, if any, they want to work on, and things that they maybe want to learn about harm reduction. And what does it mean to indigenize harm reduction? So the members in this group are from various backgrounds and experiences. Some of the members of this group work in an established syringe exchange program, do naloxone training and education and distribution. Some of them have just started in harm reduction. Some have just heard about harm reduction and said, this is something I want to do in my community. And so they joined this group because they were interested in learning those things and trying to figure out how they can do harm reduction in their own community, and really championing that work. We use a Google Groups platform so that our members can communicate. It's almost like a Facebook, but like a professional Facebook for them to discuss things just harm reduction work group related. So that is a very young group, and it's something that was just started this year. So we're still working on a lot of the details, getting a base for it. But that is the other thing that we work in collaboration with CRIB and Kaufman to achieve for our communities. To the next slide. So the other thing that we do, and this is one of those things that our organizations work on separately, is local opioid coalitions. Each of our organizations have the opportunity to apply for grant money through our organizations to work on these local opioid coalitions. Our organizations are subcontracted to either participate in an existing coalition in their community, develop a local opioid coalition to serve all populations in a county, or to develop a local coalition to serve local Indian communities, or to participate in the statewide opioid coalition, which is Kiosk. So our organizations through both SACUI and CRIB apply for funding to be able to do these things and work on these things within their own communities. Okay, yeah, to the next slide. So engaging UIHPs, earlier I talked about our members. So in this list, we have about 5 who have applied for the subcontract money to work on their own local opioid coalition. So that is the Native American Health Center, the United American Indian Involvement, the Fresno American Indian Health Project, the Friendship House Association of American Indians, and Three Rivers Lodge. Okay, go to the next slide. So in addition to working and attending and going to these coalition meetings, these grantees also wanted to work on other things. So the organizations that have this subcontract funding also, in addition to participating in their local opioid coalition or kiosk, work on hosting naloxone trainings for their community, their patients, or their staff, creating and or distributing the educational resources that either we create for them or they create on their own, developing policies and procedures around opioid use disorder prevention, MAT, and naloxone distribution within their own organizations, hosting community events to share info and reduce stigma around OUD and MAT, Typically, one of our subcontractors hosts a large powwow annually in their subcontract activity, but unfortunately, COVID hasn't allowed for that in the past year or so. And they also, one of the things that they do is add culturally centered recovery classes and groups into their organizations. So these are all different things that the organizations are working on. Whatever the organization works on depends on the organization. So it just varies between all of them. Okay, you can go to the next slide. So these are the CRIB subcontractors, and these are their local opioid coalitions. Each of these organizations here have developed their own local opioid coalition as an agreement to the way that CRIB had organized their funding opportunity. Ours is a little different, as you saw in the last two slides. But each of these organizations has a local opioid coalition, and they work on their own action items to their own coalitions. And they also communicate pretty regularly about what each of them are doing. So as you can see, it's pretty widespread of organizations and areas. Okay, go to the next slide. So one of the programs that I wanted to highlight, because I know that we're all dealing with COVID, and I know that a lot of our organizations' work has changed due to COVID. And one of our organizations has really taken a big step in order to combat COVID in their organization. So I wanted to highlight them. So Native Directions, Three Rivers Indian Lodge is a residential treatment center. It's one of our member organizations. They provide treatment services to men, 90-day aftercare, and transitional housing to the people who come through their treatment services. And they fully integrate culture throughout their programs, and including like beading classes, basket classes, and really just being outside in nature is one of the things that they really focus on. So at the start of the pandemic, because they are a residential treatment center, they didn't have anywhere for their new residents to quarantine or to stay, and they had no way of making sure that people weren't COVID positive whenever they showed up. And so what they did through some of their funding was purchase mobile homes for the quarantine measures. And so their new residential members would quarantine in these mobile homes throughout, I believe it was the 14 days at the beginning when things were a little bit different in terms of COVID. And so that is what they would do. Their new residents would quarantine in these areas, and in the meantime would still, receive recovery treatment services while they were in their mobile home. And then after their quarantine measures had ended, would transition to housing after that initial timeline. So I just wanted to highlight one of the really creative ways that one of our programs took. Because as we know, COVID showed up, but our need for residential treatment and substance use services didn't stop. And so they had to think of a way to continue. Okay, go to the next slide. So the last thing I wanted to talk about was our research efforts. I mentioned USC earlier. Our organization works very closely with the University of Southern California to do these research projects. So these are three of the reports that our organizations have collaborated on in the past 3 years of this funding. So the first one is the tribal response to the opioid epidemic in California. Basically taking a look at the overview of opioid and substance use services in the state of California as it pertains to American Indian Alaska Native communities. The other study that they worked on was the urban American Indians and Alaska Natives experiencing homelessness in California. So they really took a deep dive at the homeless population in California, particularly the urban American Indians, to see how that was affecting their substance use disorder and their access to treatment, and what barriers were presenting themselves. And the other thing that they worked on was in 2019, and that was addressing the opioid crisis in the American Indian Alaska Native community. So this was a statewide needs assessment done with members of American Indian Alaska Native community members all throughout the state of California, asking them what are the biggest needs that California Indian country is seeing. So that needs assessment has really pushed and guided the initiatives that are being done now in terms of the harm reduction work group, the Tribal Defined Best Practices grant. So the state really took a look at that report and said, okay, we see what you need, and here, we're gonna give you money to do it. So that needs assessment was very important to the work that we get to do now. Okay, go to the next slide. So the last thing is evaluation. So the University of California, Los Angeles, or UCLA, is working on the evaluation of this project, this entire project. And we participate in quarterly surveys to discuss the implementation barriers in facilities, but also to see what our outreach is looking like, how much naloxone we're distributing, how many materials we're getting out, how many interactions we're having with our programs and our organizations. But I really wanted to highlight what UCLA is doing with the Tribal Defined Best Practices grant, because this is what they're doing, and also what USC is doing, is taking a look at those Tribal Defined Best Practices and seeing how they're working in our substance use programs. And this is really going to guide the development of future tribal best practices and their success in our treatment services. So I wanted to really highlight that, that is something that's really big that's coming up out of California and out of this project. Okay, we can go to the next slide. And that's it. That's all I had for you. Thank you for listening and for being here. I think we have a little bit more time. I don't know if anybody has any questions. Feel free to ask.